One of the most common problems people may encounter in life is a nasal obstruction. It could be from any age, starting from a small child right up to an old man or a woman. The most common problem of nasal obstruction can be sometimes very short-term and temporary, and it could be a long-term obstruction as well, depending on what causes it. Namaskara. My name is Dr. Harihara Murthy and I am practicing at the Apollo Spectra Hospitals in Bengaluru. One of the most common problems people may encounter in life is a nasal obstruction. It could be from any age, starting from a small child right up to an old man or a woman for that matter. The most common problem of nasal obstruction can be sometimes very short-term and temporary, and it could be a long-term obstruction as well, depending on what causes it. The most common problem we come across is a common cold. And a common cold can affect anybody, and you can have a short-term obstruction for maybe a week at best, and sometimes for a few weeks at most. So this is one of the most common things. Apart from that, you can get different other causes like structural abnormalities in the nose, which are more permanent or long-term obstructions, which are not amenable to any kind of medication. Deviated nasal septum, hypertrophy turbinates, polyps in the nose, chronic allergies are the most common of them. In children, adenoids, which is the tonsillar structure which is at the back of the nose, which can cause an obstruction between 2 to 4 years of age and sometimes progress into the later years as well. Of late, after the pandemic, due to the change in the immunological responses in the body, children who are above 5-6 years of age have also developed adenoids, which is normally not the case. And this is a problem that can last and cause problems for breathing. As a consequence of that, even sleep disturbances caused by the obstruction in the nose. So these are common problems in children. In adults, like I said, structural problems, polyps, growths in the nose, which can be sometimes benign, sometimes malignant, can also cause obstructions. The other offshoots of these problems is that the breathing difficulty can cause sleep disturbances. It can cause snoring. It can cause recurring sore throats. It can also lead on to sinus disease. As a result, there can be drips in the back of the nose and discharge causing problems. So, multiple reasons why you can have a nasal obstruction. The best thing you can do is go to your nearest doctor, get identified, diagnosed properly, and then treatment, as the case may require, can be instituted so that you get relieved of the problem. A good night's sleep is dependent on normal unconscious breathing. And if you're not able to breathe comfortably, you won't get a good night's sleep. And if you don't get a good night's sleep, you're likely to have poor immunity. And that's a major problem for anybody. If you have a nasal obstruction, you need to get it properly identified. You're welcome to walk into any of the Apollo Spectra hospitals in the country, and I'm sure you will get evaluated properly, diagnosed, and treatment instituted to relieve you of your problem.